record.
Hello, everyone. I'm Malcolm Reed, co-chair of the U.S. People Living with HIV Caucus. I want to speak directly to our community in Florida, especially to everyone who depends on the AIDS Drug Assistance Program, or ADAP. On January 7th, an announcement from the County Health System's statewide medical director, Dr. Cho, said that on March 1st, it plans to make deep cuts to ADAP. These cuts could lower eligibility from 400% to 130% of the federal poverty level, end support for health insurance coverage, and even remove one of the most prescribed HIV medicines from the program's list. If these changes move forward, more than half of Florida's 30,000 ADAP clients could lose access to life-saving care. We want you to know that you are not alone. The U.S. People Living with HIV Caucus is working closely with Florida advocates, national partners, and legal and policy experts to stop, delay, or reduce the harm of these cuts. We believe that ADAP budgeting must be transparent and accountable. The state hasn't released its ADAP budget publicly since 2024, and before making any cuts, Floridians deserve to see the facts. We also believe that these changes must follow proper public process, because no one's health care should be decided behind closed doors. These cuts would not save money. They would cost lives. Without ADAP, people will lose treatment, their health will decline, and preventable HIV transmissions will rise. We are calling on the Florida Department of Health to suspend these cuts and work with the community to find real, responsible solutions. Here's what you can do right now. Talk to your provider or case manager and make sure they know these changes could affect your care, and discuss your options before March 1st. Join advocacy efforts. Connect with local and statewide organizations, including community-based groups, people living with HIV networks, and allies who are working together to protect ADAP. Tell them that these cuts will harm people living with HIV, increase long-term health costs, and threaten Florida's public health. Ask them to urge the Department of Health to pause and review this plan publicly. Even a few phone calls, emails, or shared messages can make a difference. To everyone living with HIV in Florida, we see you, we hear you, and we are standing with you. You have the right to live and to live well with HIV, and we will not stop until that right is protected for every one of us. In solidarity, we are the U.S. People Living with HIV Caucus. Thank you.